Good day, esteemed Nana College students. Today we are going to be talking about nursing pharmacology, and under nursing pharmacology, we are going to be talking about antineoplastic agents. Welcome to our lecture. Today we embark on a critical journey through the world of antineoplastic agents. These powerful medications are pivotal in the fight against cancer, offering hope and extending lives. As future healthcare professionals, understanding these agents is not just about memorizing drugs, it's about equipping yourselves with the knowledge to support patients through some of their most challenging moments. So let's begin this session with the eagerness to learn and the compassion to heal. Shall we turn to the next slide? So, as we delve into the subject of antineoplastic agents, let's first understand the scope of our discussion. This presentation will cover the mechanism of action of these agents, their classification, and the nursing considerations vital for patient care. We will explore how these drugs target cancer cells, the potential side effects, and the essential roles nurses play in administering these treatments and supporting our patients. Our goal is to gain a comprehensive understanding that will prepare you for the clinical challenges ahead. With this knowledge, you will be better equipped to provide compassionate and informed care to those battling cancer. Let's proceed to the next slide, where we'll start by looking at the treatment of cancer, the different options, not just the pharmacology, but there are different mechanisms at which we can use to actually handle this thing called cancer. So for this slide, we are going to talk about the treatment modalities, the different treatment procedures. You understand? These days there are different mechanisms at which you treat cancer. Now let's start with surgery. You see, for surgery, the surgery is the surgical removal of the cancerous tissue. It's the cornerstone of cancer treatment. It's a direct and often effective approach to physically excise the tumors. Now, the purpose actually is to eradicate the primary source of the cancer and prevent a spread to other parts of the body. Yes. Now, let's talk about radiation therapy. Radiation therapy. This method basically employs high energy particles or waves, such as X-rays, gamma rays, electron beams, or protons to destroy or damage those cancer cells. Now, the purpose is basically to target and destroy the growth of cancer cells, often used as a standalone treatment or in conjunction with other therapies. Yes, so you can use radiation therapy and surgery together. Now, chemotherapy is basically the pharmacology aspect we are trying to talk about. We are going to learn about the different drugs. Yes, we're going to learn about the different drugs. Apart from them being toxic to cancer, they're also toxic when handling. So chemotherapy basically involves the systemic administration of drugs that are cytotoxic to rapidly dividing cells, particularly cancer cells. Yes. Now the purpose is basically to treat cancer cells that have spread or metastasized. Check that one in your dictionary, metastasize, as well as to reduce the risk of recurrence. Yes. Now let's talk about the stem cell transplant. Stem cell transplant. Now this treatment basically replaces the diseased or damaged bone marrow with healthy stem cells, especially for all those leukemia, all those leukemia whereby the bone marrow starts releasing abnormal white blood cells. And abnormal white blood cell basically means reduced immunity. Yes. So it's a procedure that can restore the body's ability to produce blood cells, often high dose chemotherapy or radiation. Yes. Now, the purpose is to allow patients to receive higher doses of chemotherapy and or radiation therapy, which can be more effective against certain cancers. Mhm. Now, let's talk about hyperthermia. From the word hyperthermia, you can guess what it means. Hyperthermia therapy involves raising the body temperature or part of the body to damage or kill cancer cells while minimizing effective or normal cells. Yes, raise the body temperature to a certain level so that you can actually kill those particular cancer cells, because you see cancer cells basically are body cells, but we need to just find a way of distinguishing them from normal body cells. Yes, so one way we can do that is basically to target those particular area and then raise the body temperature to kill those particular cells. The purpose is to increase the susceptibility of those cancer cells to radiation or chemotherapy, often increasing the effectiveness of those treatments. Yes. As we navigate through the treatment modality, it is crucial for us to understand that their significance in a broader concept of patient care. Is very important for us to understand them in a broad sense when treating patients. Each method is unique, has its own unique place in oncology, as well as nursing professionals. As nursing professionals, your role extends beyond administration to encompass, patient education, management of those side effects, and emotional support. Yes, because once you see those patients, you basically, your heart, you feel them, you feel it, you feel their pain, you pity them. Yes, you wish that you could just use your hand to take it away from them. You know, our collective goal is not only to treat the disease but also to improve the quality of life for those affected by cancer. So let's proceed with a sense of responsibility and commitment to excellence in patient care. Okay? Yeah, so be a good girl, okay? Great. So here we are going to talk about the different types of antineoplastic agents or anti-cancer drugs. Yes. So, these agents are crucial in our arsenal against cancer, and as future healthcare providers, it is essential to understand how they work and where they are applied. Now, alkylating agents. Alkylating agents, these are heavy hitters. They interfere with DNA of cancer cells, preventing them from dividing and multiplying. An example is cyclophosphamide, commonly known by its brand name, Cytoxan, which is used in treating lymphomas, breast cancer, and multiple myelomas. Another potent agent is cisplatin, effective against testicular, ovarian, and lung cancer. Yes. The next one is antimetabolites. Antimetabolites. Think of this as the imposters. They mimic the normal components of a cell to disrupt DNA synthesis. You see, methotrexate, also known as Trexal or Romatrax, is used in leukemia, lymphoma, and solid tumors. 5-FU or 5-fluorouracil is effective in colorectal, breast, head, and neck cancers. You see a lot of this 5-FU in the hospital. The next one is the anti-tumor antibiotics, derived from sources like streptomyces. These agents are not like your typical antibiotics. They are specifically designed to fight cancers. Doxorubicin or adriamycin is used in breast cancer, lymphomas, and sarcomas. Mitomycin C is used in Mitomycin is used in gastrointestinal and lung cancers. Yes, that's anti-tumor antibiotics. The next one is mitotic inhibitors. Now these agents basically they target the microtubules. Yes, if you go and you learn about cell division, mitosis, you know what microtubules are. Yes, mitotic inhibitors. Microtubules are basically structures that ensure cell divide correctly. By inhibiting this, we can prevent cancer cells from dividing. Paclitaxel, also known as Taxol, is used in ovarian, breast, and lung cancers, while docetaxel is used in breast, lung, and prostate cancers. The next one is hormones. Hormones used for hormone sensitive cancers. These agents can decrease hormone stimulation. Tamoxifen or Novadex is used in breast cancer treatment, and Astrozole is used in hormone receptor positive breast cancers. Yes, you also learn of some cancer specific agents. These ones are basically tailored to target specific aspect of cancer cells. For example, trastuzumab, known as Herceptin, targets HER2 positive breast cancers, and rituximab is also used in non-Hodgkin's lymphomas and chronic lymphocytic leukemias. Yes, you know as we go through each category, consider not just only the mechanism of actions but also the side effects and the impact of on this patient's quality of life. It is our responsibility to understand these treatments to provide the best care possible. So let's move to the next slide for a deeper dive into each of these agents. Yes, so basically, I'll also release a note. I'll release a note, and that note will basically give you more details about anti-cancer drugs. Yes, my 60-page lecture notes. Yes, my great Nana students. So in this penultimate slide, as you can see, the nurse is already kitted up, putting on hand gloves to handle the very corrosive anti-cancer drugs. The drugs just touching your skin can actually just wipe and dissolve someone's skin, because the drugs would believe that your normal skin is the cancer. So when handling those drugs, take care to put on protection like hand glove and face masks, because they also have steam. Opening them can produce steam. Opening their containers produces steam that can actually patch on someone's skin. So be kitted up when handling those medications. Yes, in this slide, as we continue our exploration of antineoplastic therapy, let us focus on the critical considerations that you as nursing professionals will need to manage. Yes, for the general health, vital signs, and laboratory results, begin with a comprehensive assessment of the patient health. Regularly monitor vital signs and lab results to detect any changes early. This proactive approach is key to managing the potential complication that can arise. Yes, and also symptom management. Pay close attention to symptoms such as NV, that's nausea, vomiting, and fatigue. These are common side effects of cancer treatment, and managing them effectively can actually improve a patient's comfort and treatment adherence. So patient's well-being and coping mechanism. Address the psychosocial aspect of cancer care. Assess the patient's emotional state and provide support or referrals to counseling services as needed. Remember, holistic care is very important. Holistic care is paramount. Yes. Immunosuppression and side effects. Basically, what we mean by immunosuppression is basically, there are drugs that basically have the function of reducing the immune system, because sometimes the immune system can actually act against the body. So be vigilant for signs of immunosuppression and other side effects like bleeding or neuropathy. Implement appropriate intervention promptly to mitigate this risk. Yes. The next one is medication administration. Administer medications as prescribed. Ensure accuracy in dosage and adherence to treatment schedule. Educate patients on administration techniques, particularly the differences between oral and IV method. Prior to chemotherapy, take preventive measures such as administering antiemetics to prevent vomiting, to prevent nausea. I'll say, some of these drugs can actually be nauseating. That they can make the patient to feel the need to vomit. Yes, use personal protective equipment (PPE) when handling medications to ensure safety, as you can see. Yes, supportive measures. Implement supportive measures like oral hygiene, skin care to enhance patient comfort and prevent complications. Yes. So in conclusion, you understand your role as nurse is very much integral to the treatment process. Your attention to the consideration will not only optimize patient outcome, but also ensure a safer and more supportive environment for those undergoing antineoplastic therapy. Yes. So the patient is your friend. Like police is our friend. The patient is your friend. Yes. So thank you very much for listening. I'll prepare more slides for the next lecture and I'll notify you as needed. Thank you very much.